And thank you for outlining how well we are doing in a series of metro areas. What also has been encouraging for those of you who are watching epidemic curves every day, and I'm sure you are, and watching them in log phase, because that's how epidemiologists like to look at their curves, you can see for the first time that in the United States we're starting to level on the logarithmic phase like Italy did about a week ago. And so this gives us great heart that not only in specific places, but we're starting to see that change. Obviously, a lot of that is driven by the improvement in New York City. Remember, for a long time, they were over 50% of our cases and 50% of our new cases. That has dramatically changed because of the impact of what the citizens of New York and New Jersey and across Connecticut and now Rhode Island are doing to really change the course of this pandemic and really change the trajectory of new cases. We're seeing that what many states and metro areas were experienced as twofold and fourfold increases that went to twofold, that now those are going to 8 days between the doubling rate. Watching this every day gives us hope across these metro areas from New York and New Jersey and all through Denver and, of course, through New Orleans. We still see cases occurring in the Boston area and in Chicago, but their rate of increase seems to be stabilizing. And we really want to call out the work of the mayors of Baltimore and the district and Philadelphia, who have really brought all of their health experts together and working with their communities are starting to really change the curves in those areas. What we're seeing is we're united in social distancing, and that's been very encouraging to all of us, and it should be encouraging to the healthcare providers that are on the front line, many of which are serving our Americans with such dignity and respect and ensuring that everybody gets optimal care. And as the President noted, our mortality in the United States is significantly less than many of the other countries when you correct them for our population. And that is really solely the work of our frontline healthcare providers. And so working with, you can really, hopefully you get the theme today that we are incredibly proud of our public health leaders at the city level, at the state level, at the federal level, who are working together to really change the course of this pandemic, working with their citizens and their communities to make these changes. And the American public, who have really taken all of this to heart and stayed home. I know last week we really asked a lot of people in the Washington and Baltimore area to consolidate, not go out frequently to grocery stores or pharmacies. You can really see that that's having a huge impact. So it's really about the encouraging signs that we see, but as encouraging as they are, we have not reached the peak. And so every day we need to continue to do what we did yesterday and the week before and the week before that, because that's what in the end is going to take us up across the peak and down the other side. We continue to really applaud the work of California and Washington State and Oregon. We're learning from all three of those states, from their public health officials, about how they were able to keep the virus from ever becoming logarithmic. And I think that's an important lesson for all of us on how they did that, what the timing was in case we ever have to face this issue in the future. Thank you, Mr. President.
Thank you very much, Deborah. Tony? Doctor, please.
Thank you very much, Mr. President. So again, just keeping on the theme that Dr. Birx had mentioned, this is the end of the week, that famous week that we spoke about last weekend, in which what actually was predicted to happen happened. We're starting to see the leveling off and the coming down that Dr. Birx had mentioned. But it's important to remember that this is not the time to feel that since we have made such important advance in the sense of success of the mitigation, that we need to be pulling back at all. I was actually heartened by the fact that we've been talking about the New York, New Jersey, New Orleans, and other areas where they have really big spikes. But there's other parts of the country, in the middle parts of the country, where they're concerned to make sure they don't get those spikes. And I really want to salute the governors of states throughout the entire United States, but particularly in the central part of the country, because the governors obviously see us in these press conferences, and I've had calls over the last several days from several of the governors, from Nebraska, Iowa, South Dakota, Utah. Just about an hour and a half ago, I spoke with the governors of Arkansas and Wyoming, who are really committed to make sure that they don't get into the situation where they're going to have spikes in their state. And they're doing the kinds of things that they don't get recognized because people don't talk about them much. But we have a big country. We have 50 states, and it's not only the big cities. So if we're going to pull out of this, we're going to pull out of it in the big cities, and we're going to pull out of it in those areas that aren't as densely populated. And I just want to give a shout out to them. They're doing an extraordinary job. I was really pleasant, I wouldn't say surprised because I expect it of this country, but to hear what they're doing and the commitment that they're putting into making sure that we don't have the kinds of situations that we've experienced, unfortunately, in other areas. This is very important. I just want to close by one other thing, something I mentioned yesterday and the day before, that there are a lot of candidate interventions that are going into clinical trials. For those of you who are interested in it, I recommend you go to clinicaltrials.gov, and you'll see the design of a clinical trial, and you see that many of them are the randomized controlled trials that are the really gold standard of how you find out whether something really is safe and effective. And as the weeks and months, and it'll probably be months, sometime in the summer, we'll start to see which are working, which are not, and to focus on those that are we developing and will working. I'll be happy to answer questions later. Thank you.
Thank you, Mr. President. The White House Task Force has been very focused on increasing the supply of personal protective equipment for our great providers. I was one of those providers a few months ago, and I can tell you nothing is more important than making sure they have what they need. So in order to increase the supply of N95 masks, FDA has worked with industry and has now authorized 2 companies who will supply machines to sterilize N95 masks. Admiral Polovchek and FEMA are purchasing on behalf of U.S. government 60 sterilization machines, as mentioned by the President, and they will be positioned around the country to increase the amount of supply of N95 masks. Each machine will be able to sterilize 80,000 N95 masks per day, and we hope to actually increase that further. The Vice President and the White House Task Force challenged us yesterday, and we responded as a team. FDA issued revised guidance regarding the laundering of gowns, because gowns are another issue in terms of supply that we're looking forward on. This is not something that normally happens around the country, but issued this guidance. It's on our website now at FDA, so there's information about how hospitals can do that to increase the supply. We've heard concerns that maybe hospitals might not want to do that because of regulations, and I can happy to tell you that Administrator Verma and I have worked on this. Certified providers and suppliers who follow FDA guidance as posted on the website will be compliant with Medicare and Medicaid requirements. And then finally, last week, FDA provided guidance to manufacturers on manufacturing specifications for cloth gowns. This is another attempt to increase the number of gowns. Typically, it's plastic or other types of materials. And this guidance, if followed, can be used by manufacturers to actually make these gowns, and no further regulatory red tape will be necessary. They can go into circulation. Thank you.
Thank you very much. Please.
Thank you, Mr. President. Good afternoon, everyone. I started off the week talking about the challenges that lie ahead, and I want to finish the week just by reiterating what you've heard. Mitigation works. It definitively and quantitatively is working, and I want to say thank you to America for your efforts to help flatten the curve and to save lives. But at the President's direction, yesterday I met with 2,000 Hispanic leaders from their communities, and today the Vice President led a phone call that I was on with hundreds of African American leaders, including the Reverend Jesse Jackson, including Derek Johnson of the NAACP, including the National Medical Association and the Black Nurses Association, to talk about some of the alarming trends we're observing regarding the impact of COVID-19 on communities of color. And you've heard the stats in New York City. Hispanics represent the majority of deaths. In Milwaukee County, blacks are 25% of the population, but almost 50% of the cases and 75% of the deaths. So what's going on? Well, it's alarming, but it's not surprising that people of color have a greater burden of chronic health conditions. African Americans and Native Americans, excuse me, develop high blood pressure at much younger ages. It's less likely to be under control and does greater harm to their organs. Puerto Ricans have higher rates of asthma, and black boys are 3 times as likely to die of asthma as their white counterparts. As a matter of fact, I've been carrying around an inhaler in my pocket for 40 years out of fear of having a fatal asthma attack. And I hope that showing you this inhaler shows little kids with asthma all across the country that they can grow up to be Surgeon General one day. But I more immediately share it so that everyone knows it doesn't matter if you look fit, if you look young, you are still at risk for getting and spreading and dying from coronavirus. The chronic burden of medical ills is likely to make people of color, especially, less resilient to the ravages of COVID-19, and is possibly, in fact likely, that the burden of social ills is also contributing. Social distancing and teleworking we know are critical, and you've heard Dr. Birx and Dr. Fauci talk about how they prevent the spread of coronavirus, yet only 1 in 5 African Americans and 1 in 6 Hispanics has a job that lets them work from home. People of color are more likely to live in densely packed areas and in multi-generational housing situations, which create higher risk for spread of a highly contagious disease like COVID-19. We tell people to wash their hands, but a study showed 30% of the homes on Navajo Nation don't have running water. So how are they going to do that? In summary, people of color experience both more likely exposure to COVID-19 and increased complications from it. But let me be crystal clear. We do not think people of color are biologically or genetically predisposed to get COVID-19. There is nothing inherently wrong with you, but they are socially predisposed to coronavirus exposure and to have a higher incidence of the very diseases that put you at risk for severe complications of coronavirus. But as the Vice President shared on the call this morning, this history, and I want you to hear me say this, it does not have to be our nation's future. We're taking steps now in the midst of the COVID-19 pandemic to reach, protect, and strengthen all communities impacted by this disease, and especially our communities of color. More details will be forthcoming, but we are actively working, as the Vice President and the CDC Director laid out today, data collection, targeted outreach to communities of color, and increasing financial, employment, education, housing, social, and health supports so that everybody has an equal chance to be healthy. And I want to close by saying that while your state and local health departments and those of us in public service are working day and night to help stop the spread of COVID-19 and to protect you regardless of your color, your creed, or your geography, I need you to know you are not helpless. And it's even more important that in communities of color, we adhere to the task force guidelines to slow the spread. Stay at home if possible. If you must go out, maintain 6 feet of distance between you and everyone else, and wear a mask if you're going to be within 6 feet of others. Wash your hands more often than you ever dreamed possible. Avoid alcohol, tobacco, and drugs. And call your friends and family. Check in on your mother. She wants to hear from you right now. And speaking of mothers, we need you to do this, if not for yourself, then for your abuela. Do it for your granddaddy. Do it for your big mama. Do it for your pop-pop. We need you to understand, especially in communities of color, we need you to step up and help stop the spread so that we can protect those who are most vulnerable. This epidemic is a tragedy, but it will be all the more tragic if we fail to recognize and address the disproportionate impact of COVID-19 and an array of other diseases and risk factors on communities of color. The task force and this administration are determined not to let that happen. The President, the Vice President have said we will not let that happen. We can't fix these issues overnight, but I promise you we will work with your communities to quickly and meaningfully move the needle in the right direction. Nothing less than the fate of our families and friends. My family and friends depends on it.
Thank you, Mr. President. Today, the White House Coronavirus Task Force met and heard from the President the gratitude that he and I know all the American people feel for all the dedicated workers at FEMA, HHS, U.S. Public Health Service, FDA, and all those that are literally working on your behalf around the clock to partner with states, to partner with local health officials. And Mr. President, allow me to add my thanks and admiration to all of the entire team here at the federal level. On this Good Friday, we remember those who've lost their lives to the coronavirus. We remember their families, our dedicated healthcare workers, and our first responders. And we do well on this special day for Christians across this country to remember them in our prayers. But as you just heard from Dr. Birx and from the experts, it's also a good day to remember that Good Friday is always followed by Easter Sunday. And there is hope. There is hope in this moment that thanks to what the American people are doing every day, adhering to the President's coronavirus guidelines for America, thanks to the fact that Americans are listening to state and local leaders and putting the health of their family members and neighbors first, we're getting there, America. We're making progress. But it's imperative that we all continue to implement all of the guidance in the 30 days to slow the spread. As the Surgeon General just attested, at the President's direction, we engaged more than 400 leaders in the African American community today, and allow me to express my appreciation for their leadership and their efforts in communicating to African Americans and other minority populations some of the unique challenges that those communities face in the midst of this epidemic. And the CDC, as the Surgeon General said, is working on not only studying the issue, but very rapidly issuing new guidance, and we'll be communicating that new guidance to all of those great leaders. On the subject of testing and supplies, the President gave a great amount of detail. More than 2.1 million tests have been performed, and we continue to work very, very closely with FDA and suppliers around the country to expand the ability of testing. And you just heard Dr. Hahn reflect on the fact that very soon we will have an antibody test that Americans will be able to take to determine whether they ever had the coronavirus. I spoke today to the governor of Colorado, Jared Polis. We've been in contact with Senator Cory Gardner about an outbreak at a particular meatpacking facility in the Colorado area. And at this time, our team is working with the governor and working with the senator to ensure that we flow testing resources. At this point, there are some 14 people hospitalized, maybe 200 to 300 of the workforce have been impacted, and we spoke about providing those resources this weekend. I want to encourage people in Colorado that we will work to support that effort, but I also want to emphasize that all of the people that are working in food supply, from farmers to meat packers to distributors to truckers to grocers, continue to have our gratitude, as President Trump said just a few moments ago. On supplies, more than $5 billion have been obligated to the states. 29,600 National Guard have been activated. And at the President's direction, more than 4,700 active duty military personnel have been deployed, medical military personnel in 9 states, focusing on the areas of most significant epidemic. Air Bridge, 26 flights have been completed. 4 flights are scheduled to arrive today, bringing 250,000 gowns, 25 million pairs of gloves. 54 more flights are scheduled, literally bringing in supplies from around the world. Finally, let me say, as we go into this very special weekend, into Easter services, I know I speak on behalf of the President when I say how grateful we are to all of the churches that have been there, and their ministries have been working under great difficulty to continue to provide for the needs of your members. There have been food drives, there have been phone calls, and ministry has continued, and we are grateful for the role on this Holy Week that our churches, our synagogues, and all of our houses of worship have played. On their behalf, allow me to remind you that even if you're not in the pew this Easter Sunday, if you are able, it's still a good idea to give, because those ministries continue to go forward, and we encourage you. We encourage you to continue to support them. We also want to say very respectfully to all the church communities around this country and all the places of worship to continue to heed the guidelines issued in the President's coronavirus guidelines for America. We know it's difficult in this time of year, particularly, Mr. President, to avoid gatherings of more than 10, but we're grateful that so many churches, synagogues, and places of worship have done just that, and we urge you to continue to do it. And to my Christian brothers and sisters across the country, let me encourage you with the words. We should all remember that Jesus said, wherever 2 or more are gathered, there he is also. And so you can worship, you can celebrate Easter. and know that you'll be blessed in so doing, and you'll be serving the nation. Thank you, Mr. President.
Thank you, Mr. President. So the testing, I want to reemphasize about what kind of testing we're talking about. This is RNA diagnostic testing. That is the platform that was built to respond to this epidemic. It is the same platform that we utilize for HIV viral loads. And so many HIV clients have also given up their space on the machines to have these tests run for all of Americans. This assay is complicated. It's not like an assay that you have for your other diseases, your strep test or other diseases like that. This is a very complicated assay that requires a lot of technical oversight, and it's part of the reason why not all 100% our machines are running at full capacity, but we had great discussion with the lab directors about that. Every day more are brought online, and so, but I think we have to create expectations of what the daily test rates will be. Last year, we probably did 3 million HIV viral loads or 4 million HIV viral loads as a country. We've done over almost 2.2 million in 4 weeks. So this is unprecedented in what we have to do. I think that's why we're working very hard for 2 pieces, and I want to make sure that people understand testing is just part of our strategy. The other part of the strategy has to be this syndromic and influenza-like illness where there's an alert to an illness, and so that we're surveying where we know the most vulnerable cases have appeared. And the great call that I had with the mayors and with the health officials yesterday and mayors today, a lot of the rural areas, their primary, and as it was in Washington and California, was at the nursing homes. So the issue is to build a testing strategy that speaks to our strengths, of laser focusing a strategic approach to testing when we know what our volumes are, and they increase every day, but we have to be realistic about what the volumes will be a week, 2 weeks, 3 weeks from now, and combine that with strategic surveillance so that we're testing symptomatic people and their contacts very quickly to go back to contact tracing, utilizing our complete strategy. And I think we're very much interested, and it's why the president 3 weeks ago really put us on getting an antibody test. And I think I called from the podium for our university colleagues and hospitals to begin an ELISA-based test because that's a blood draw, but we really wanted a finger prick to make it easy and deployable. That's what's being worked on now. Of course, we don't want to promise until we have it, because I think we deserve that, the American people deserve that, to have a test that is efficient to let people know who's been positive for immunity. That's critical to epidemiologists and public health officials to know what the penetrance of a virus was into a community when all you're seeing are the serious cases and testing the most symptomatic. And so that's a question that we still have. Is this the tip of the iceberg, or is this half the iceberg or 3/4 of the iceberg, what we have seen to date? And we have, I just want to complete the thought by saying, in the areas where we had an outbreak, these large metros, Louisiana, Denver, Detroit, Chicago, New York, New Jersey, but per capita, we've done more tests than any other place in the world. That was intentional. We focused the test where the need was the greatest and the burden of disease the greatest. And now we're trying to really see how strategically that very valuable resource can be utilized around the countries to create a mosaic of testing combined with surveillance.
First of all, Peter, I haven't seen that, so I can't quote on that. But, yeah, that's okay, I still haven't seen it. I've been in here all day.
I'm just saying, to me, I'm just telling you what I know.
So what I think that they're talking about is that whenever you pull back, you would expect that you might start seeing cases. And what we've been talking about, what Dr. Birx has just mentioned, is that when you see that, that's where you want your resources to be able to very efficiently, in real time, identify, isolate, and contact trace. So don't let anyone get any false ideas that when we decide at a proper time when we're going to be relaxing some of the restrictions, there's no doubt you're going to see cases. I would be so surprised if we did not see cases. The question is how you respond to them. I think that's what they were referring to.
Thank you. I have a quick question for you. You said that African Americans and Latinos should avoid alcohol, drugs, and tobacco. You also said do it for your abuela, do it for Big Mama and Pop Pop. There are some people
I said
already
granddaddy too.
there are some people online that are already offended by that language and the idea that you're saying behaviors might be leading to these high death rates. Could you talk about whether or not could you, I guess, have a response for people who might be offended by the language that you used?
Well, I use that language because that's the language. I've been meeting with the NAACP, with the National Medical Association, with others. I actually talked with Derek Johnson multiple times this week, the head of the NAACP, and we need targeted outreach to the African American community, and I use the language that is used in my family. I have a Puerto Rican brother-in-law. I call my granddaddy, granddaddy. I have relatives who call their grandparents Big Mama. So that was not meant to be offensive. That's the language that we use and that I use, and we need to continue to target our outreach to those communities. It is critically important that they understand it's not just about them, and I was very clear about that. It's not just about what you do, but you also are not helpless. We need to do our part at the federal level. We need people to do their parts at the state level, and we need everyone, black, brown, white, whatever color you are, to follow the president's guidelines, the coronavirus guidelines, and do their part. Because when I talked to the NAACP 3 weeks ago, it's important to note that one of the things they asked me was, can you help dispel the myths in this community that people actually can't get coronavirus if they're black? That was a myth that was out there that's actually very important for us to squash here.
And that all Americans avoid tobacco, alcohol, and drug use at this time?
Absolutely. It's especially important for people who are at risk and with comorbidities, but yes, all Americans. So thank you, and I will clarify that. All Americans need to avoid these substances at all times. I put out a smoking cessation report in January. I put out an advisory against youth and pregnant women using marijuana last year, and that was not directed towards any one race. That's everybody needs to do everything they can to be as healthy as possible at this critical time. Dr. Fauci, would you add anything?
Yeah.
Jerome, you did it beautifully. I can't do it any better than that. And I know Jerome personally, and I can just testify that he made not even a hint of being offensive at all with that comment. I thought that was appropriate. Yeah, I mean, from pure public health issues is that if you have a situation in which you don't have a real good control over an outbreak and you allow children to gather together, they likely will get infected. And if they get infected, the likelihood that they will bring the infection home. So that really is a risk. I don't know the situation at all in any detail, and I'm not specifically speaking about Florida. I'm just speaking generically about what happens when you have infections in the community and you have a congregation of people, such as in classrooms, that's a risk.
Has anyone under 25 died, Dr. Fauci, in the country?
Yes.
The governor
Yes.
said that no one under 25 has died. I guess you could clarify that people under 25 can die as a result of this
Maybe in Florida they have.
Yeah, I'm not sure. Again,
in the country.
okay, let's do that because I don't want to have to be answering for a particular state. Yes, people under 25 have died of coronavirus disease in the United States of America.
The models, as I understand them, are based on social distancing continuing through May. Is that correct? And if you were to open the economy on May 1st or sometime during that month, would that impact the models in terms of the deaths that you expect?
So the model, the IHME model, does state that it's through May. We've had these model discussions, haven't we, for weeks now. So the models are informed by the data, and you can see how much that model has shifted on the amazing work of the American people. So I think that's what we're evaluating right now. Remember when I talked yesterday, I've been in public health a long time. I have never, except for Ebola, where we worked very closely with the communities about specific issues, we've never taken a countrywide or a global-wide approach to mitigation. This is unprecedented. I will tell you there is nothing in the literature about specifically what to expect, and I think that's why the models continue to modify themselves based on what actually has happened with social distancing and hand washing and all of the pieces that the American people are doing, the decreasing, the closing of the bars, the closing of the restaurants, no communal eating, that was thought to be a very big issue in many of the other cultures that went through this virus. So the models continue to evolve based on the impact. And so therefore, it makes it very difficult to interpret each component of social distancing and which ones are absolutely critical. Now, there's a way to do that in multivariate analysis potentially. Now, I want everyone to understand there are states that are testing. There are states that are doing contact tracing. So, I mean, I think sometimes we get, we look at what New York is doing and Detroit, and we forget that there's a Utah and a New Mexico and a North and South Dakota and a whole series of states that have been doing testing and contact tracing and have been testing at rates higher than that per capita rate that we all have discussed. So we're looking at that. What did they do? Where are the most vulnerabilities? Where are the outbreaks most likely to occur? And that's why I've been talking about nursing homes, because we do believe that there's a relationship between age and seriousness of disease. Not to say that there can't be young people with serious disease, but proportionally, it's a smaller piece with serious disease. And so when you have that kind of spectrum where the older and the more complicated, the higher the severity, you get the impression that there may be more asymptomatic in younger age groups, and that's where the antibody test comes in. So when you put all these pieces together, you're trying to understand where would be the first signals. So we have surveillance out there right now with the CDC's influenza-like illness. I hope you're all tracking that. It is showing these small changes. I think we can believe in that as a surveillance tool married with their syndromic piece, giving us the insight about where to test and then where to proactively test in nursing homes and other vulnerable groups, because that has been the signal in a series of the states that have very, very low prevalence and incidence of disease. So that's the kind of factors we're putting all together to really define the best way forward. And we have superb roadmaps. I hope you all have seen them. There's been about 6 different roadmaps to opening that people have put online. And again, there's no literature that you can cite and said, well, we did this 20 years ago and what really worked. There isn't that. There's brilliant public health people giving us their insights.
The core of the question is, because those are the models you've been using, if you do go with starting to open up the economy again on May 1st, doesn't that lead to more deaths?
Well, look at how much it changed with mitigation. And now we're looking at those state by state, and there's some states in there that are still in contact tracing. So we're looking at the impact of that model and what that model predicted based on the type of contact tracing, less mitigation, more contact tracing. Are you getting what I'm talking about? No. Okay, so there are states that didn't stay-at-home orders, but we're doing contact tracing from outbreaks. So we're looking at them and how they have done, and we're looking at certainly what's happened in the big metro areas. And we're integrating all of that data together to make a plan going forward. So I can't tell you, because look at how much the model has changed in just a week. Remember, just a week ago, it was 80,000. Now it's 60,000. So, and the curves, I'm sure you're all watching it, the curves are getting much broader confidence intervals. There is still the dotted line, but the confidence intervals around the dotted line are getting bigger. When you see that, you know the model has a bit of instability. And so that's why Tony and I base a lot of our decision and discussion on cases and what physically is happening in that county and that state. At the same time, not ignoring the models, but integrating the models as one piece of our thought process.